This is a very good question. So I got diagnosed with genital herpes HSV2 back in probably like 2016. Phalloplasty was something that I was seriously considering, earlier on in my transition. And when I got my diagnosis of HSV2, the perspective of not being able to possibly get bottom surgery was much more devastating to me than, having to tell future partners or how it would affect my dating life. Bottom dysphoria has always been a much bigger issue for me than top dysphoria. I mean, I'm so glad that I was able to have top surgery and everything, but bottom dysphoria, honestly, it's like really gotten in the way of my relationships. It's ruined some of my relationships. I know it's ridiculous, but I have to say this. I'm not a doctor. So this question is difficult, if not impossible to definitively answer because one, the research on trans men in general is very limited, but only 3% of trans men even get phalloplasty, so that's even more limited. Then when you add like having an STI, like that makes it even more limited. So for me personally, having genital herpes is a big part of why I decided I was not going to follow through with seeking out phalloplasty. Now, everybody is different when it comes to HSV2. In fact, most people are asymptomatic, which means they show no symptoms at all. That's one of the reasons it spreads like wildfire, because most people don't even know they have it. So for people like that, maybe like, the prospect of bottom surgery is a lot different than it would be for me. Personally, antivirals do not always work for me. Stress is a huge trigger with my outbreaks, and recovering from surgery is really stressful. So for me, I just think that that would be a recipe for disaster. So another thing to consider, I'm assuming, is whether or not someone has HSV1 or HSV2. Now, both can affect people genitally. A lot of people are under the assumption that HSV1 is just on the mouth. Primarily it is, but not always. Genital herpes can come in forms HSV1 and HSV2, and HSV1 actually has typically less of a recurrence rate than HSV2. People who do experience reoccurring, outbreaks with genital herpes like more frequently typically have HSV2. So I'm sure this is something to consider as well. But yeah, for me personally now, it's definitely not something that I would consider. And I do feel that I'd be at higher risk for like infection or like, serious complications. To my knowledge, unless this has changed, with phalloplasty, there's almost always complications. That doesn't always mean they're like severe complications, but it just seems like not a good idea to add, genital herpes into the mix.